For radiotherapy per se, radiotherapy, the dietary effects depend on the area of radiation, the total dose, the fraction, the duration, and whether the radiation given with chemotherapy. Usually the course of radiation is around 6 to 8 weeks. Sometimes patient duduk dekat ward up to 2 months, 1.5 months, depending on their current status. And most patients feel increasing fatigue and weight loss and become malnourished over the course. And then the side effect actually for radiotherapy, it can happen as early as week 2 of the treatment, and it pick up to 2/3 of the treatment. And for the altered taste, kadang-kadang patient langsung tak rasa at week 3, and sometimes lasting about 3 weeks, 3 months, or up to 2 years. Nausea, vomiting occur at day 3 post radiation in half of the patient receiving upper abdominal radiation, and almost 100% in patient receiving total body irradiation, total body, satu badan radiotherapy. After radiation ends, most side effect lasts around 3 to 4 weeks, but sometimes last much more long. So this is the radiotherapy and nutrition related impact symptom. So basically, the nutrition impact symptom is quite similar, only at the gynecological part. Sometimes patient have early satiety. Yang lain muntah, loya. Kadang-kadang you have this radiation at ovary or something like that. Patient still have this mouth sore or something like that. Usually the upper part of the body, there's a taste changes, mouth pain, mouth sore, dry mouth, dysphagia, or even diarrhea. But the lower part, stomach, usually nausea, vomiting, and diarrhea. Okay, that one is only in summary. So for head and neck cancer patient, actually the doctor will give this beam directional mask. So this mask actually to produce well-defined radiation field. But if let's say patient have this weight loss, not eating properly, not comply with that regime, and then subsequently weight loss, so the mask will not fit properly, and also it might affect the treatment outcomes. So for hematopoietic stem cell transplant, patient receiving allogenic donor cell often develop more severe nutritional problem, mucositis, but everything is depend on the level of cytotoxicity of the immunosuppressive drug regime. And of course, they have difficulty in meeting the calorie or protein needs. And this nutritional deficiency also result from GVHD, acute graft versus host disease, especially of the alimentary tract. So resulting in these changes, dry mouth, thick saliva, mouth and throat sore, nausea, vomiting, diarrhea, constipation, lack of appetite, and subsequently weight loss. So teamwork and good communication skill is very, very important. So in HKL, we have this, I think more on a lot of discussion, especially on head and neck cancer patient. So all this discussion or multidisciplinary team approach actually is for quality of care for this oncology patient. Okay, this is for example the discussion that usually occur at in our ward.